How do antibiotics treat pelvic inflammatory disease and fertility? Pelvic inflammatory disease, often referred to as PID, is an infection affecting the upper female reproductive tract, which includes the uterus, fallopian tubes, and ovaries. This condition is frequently caused by a combination of bacteria, particularly those linked to sexually transmitted infections like Chlamydia trachomatis and Neisseria gonorrhea. So, how do antibiotics fit into this picture? Antibiotics are crucial in treating PID because they work to target and eliminate the bacterial infections responsible for the illness. By doing this, they help reduce inflammation and prevent damage to the reproductive organs, which is vital for maintaining fertility. Treatment typically involves a combination of antibiotics to cover the various bacteria that may be present. When a diagnosis of PID is suspected, doctors often start antibiotic treatment right away, even before specific test results come back. This prompt action is essential to prevent the infection from worsening. The course of antibiotics usually lasts between 10 to 14 days and may begin with an injection, followed by oral tablets. It is important to complete the entire course of antibiotics to ensure the infection is fully cleared and to minimize the risk of complications. By effectively eradicating the infection, antibiotics help reduce inflammation and tissue damage in the reproductive organs. If PID is left untreated or not adequately treated, it can lead to scarring and blockage of the fallopian tubes. This can result in infertility, ectopic pregnancy, or chronic pelvic pain. Therefore, effective antibiotic treatment is key to preserving fertility by preventing or minimizing such damage. Research shows that different antibiotic regimens have high clinical cure rates, ranging from 90 to 97% against the common pathogens associated with PID. Some effective combinations include clindamycin with ciprofloxacin, doxycycline with metronidazole, and azithromycin-based therapies. However, some antibiotic regimens may not be as effective against certain anaerobic bacteria, so the choice of treatment is guided by clinical guidelines and the severity of the disease. In severe cases, intravenous antibiotics and hospitalization may be necessary. From a fertility perspective, it is important to understand that while antibiotics can effectively treat infections related to PID, the condition itself can contribute to infertility due to pelvic inflammation and scarring. Endometriosis, a separate chronic inflammatory condition, can also impact fertility, but antibiotics do not treat endometriosis. However, managing PID promptly with antibiotics helps prevent additional inflammatory damage that could worsen fertility issues in women, whether they have endometriosis or not. In summary, antibiotics play a vital role in treating PID by eliminating bacterial infections, reducing pelvic inflammation, and preventing damage to the reproductive tract that could impair fertility. Early and complete antibiotic treatment is essential for preserving fertility and avoiding long-term complications associated with PID. Women experiencing symptoms of PID or pelvic pain should seek medical evaluation promptly to receive appropriate antibiotic therapy and care focused on preserving fertility.